Hello, everybody, and welcome to today's webinar. My name is Elizabeth Barr, and I'm a program officer in the Office of Research on Women's Health at the NIH. Welcome to today's webinar. ORWH's virtual speaker series titled Diverse Voices, Intersectionality, and the Health of Women disseminates research findings that are relevant to diverse groups of women and that incorporate a multidimensional intersectional focus on sex or gender. The speaker series aims to increase public awareness, understanding, and engagement with research relevant to diverse populations of women. It also seeks to highlight work by investigators who have received funding from ORWH, are affiliated with the office, or utilize an intersectional or multidimensional framework. The agenda for today's session is shown here. Today's meeting is being recorded. All registrants will receive a follow-up email with a link to the recording, as well as information about subsequent sessions of the Diverse Voices speaker series. We have live captioning available today. If you need captioning, go ahead and click on the closed caption button in the Zoom menu bar at the bottom of your screen to enable captions. All participants will be muted during today's event. Please enter any questions that you have for our speakers using the Q&A feature. I will now pass the virtual microphone to my colleague, Dr. Mia Whitaker, who will introduce today's speakers.
Good afternoon, everyone. My name is Dr. Mia Whitaker, as my colleague Elizabeth just said, and I'm going to be introducing our speakers today. M.K. Serwick is a nurse, cartoonist, and educator. Her clinical nursing experience is in HIV/AIDS care and hospice care. M.K. has published comics under the pseudonym Comic Nurse since 2000. She is the creator of the graphic memoir, Taking Turns, Stories from HIV/AIDS Care Unit 371, an editor of the two-time Eisner Award-winning Menopause, a Comic Treatment, and a co-author of Graphic Medicine Manifesto. MK regularly teaches graphic medicine at Northwestern Medical School, the School of the Art Institute, and the University of Chicago. She has served as a senior fellow of the George Washington School of Nursing Center for Health Policy and Media Engagement, and as the artist in residence at Northwestern Feinberg School of Medicine. Whit Taylor is I apologize about this in advance, but Ignace, I'm sorry, I can't pronounce that word, but award-winning cartoonist, editor, and public health educator. Whit has a BA in cultural anthropology from Brown University and an MPH in social and behavioral health from Boston University School of Public Health. Whit's comics have been published by The Nib, The New Yorker, The Washington Post, Little Brown, Young Readers, and the Radiator Comics, Silver, Sprocket, and others. Whit Taylor's and Joyce Rice's public health history graphic novel, The Greater Good, will be published by the second in 2015. My apologies about that. I will now pass the virtual microphone over to MK. MK, the floor is yours.
Thank you very much. Whoops. And I'm going to share my screen here, if that's okay. And hopefully that's coming through all right.
Looks great.
Yes.
Thank you. Thank you very much. I am absolutely thrilled to have the opportunity to speak with all of you today. Thank you very much. So quickly, what I'd like to discuss, I'll outline here, is kind of who am I and how did I get to doing this crazy work of using comics in healthcare? A quick introduction to graphic medicine and how it's being used. And then how can comics help to conduct and disseminate research? So this is my elevator pitch when I kind of talk to people about what it is I do. It's that I'm a nurse who uses comics to contemplate the complexities of illness and caregiving. And as was mentioned, these are the books that I was a part of creating. I'm very proud of all of them, but I'm most excited about the anthology of comics about menopause because I think they really demonstrate one of the great things comics can do which is just to help dispel stigma and to talk about things that we have a hard time talking about. The fact that this book was called Menopause and that it won an Eisner Award, which is kind of one of the Oscars of comics, and that it was a New York Times best of. So it got people to say the word menopause a lot more times than they would have that year. But also I created it because so much of what I found out in popular culture about menopause was so offensive to women. And I said, we need to do better. And this is a collection of comics that do better. So I'm very proud of that and all the work I've been able to do through graphic medicine. Really, this is why I'm here. My work attempts to use the medium of comics, which I find incredibly powerful, to help make challenging situations somewhat easier for patients and families. And if you're interested in finding out later more about my work, my website is comicnurse.com. I started making comics. I was not the kid at school who could draw, but I started making them while I was working as a nurse on an AIDS unit at the height of the AIDS global epidemic. Because, you know, one of the things is in nursing school, you don't get taught how to deal with a lot of the difficult loss and pain and you know, secondary trauma that you experience as a healthcare provider. Rachel Naomi Remen, who's a physician and a chaplain, she wrote, you know, expecting to see the kinds of things that we see as caregivers and not be impacted by them is like expecting to walk through water and not get wet. But yet, unfortunately, a lot of our professional education for physicians and nurses and allied health professionals doesn't really cover a lot of that. So I was really struggling to figure out how was I going to cope with so much loss and be present to my patients rather than caught up in my own grief. And what came as an enormous surprise was that I started making comics. And as I said, I was not the kid at school who could draw. You can tell by, I don't expect you to read these, just looking at these very early comics that I used to process clinical experiences. And part of why I think that worked is because in a comic, I would just start here. And by going through just a number of boxes, pairing image and text sequentially, I would find myself here. And this was the most effective thing of all the sort of self-care things I could do to help me get through that difficult time and to continue to do this. After I finished my clinical time and I thought about maybe doing other work, I knew I wanted to focus on comics, and I was very curious, like, why did those comics help? How can stories help us heal? And so rather than learning how to draw, because I kind of like my goofy little childlike style, I decided that I would actually study the field of health humanities or medical humanities. So I could think about and learn from scholars who have actually thought carefully about that question, how come stories help us heal? And I wanted to put all that work to work in my comics, but I wasn't talking about that in my education. I wanted to be taken seriously. So I was, of course, using scholarly terms and articles and everything until I came across this book at the Museum of Contemporary Art in Chicago in their bookstore. And I remember thinking like, oh my God, that is a image I am very familiar with clinically. I have never seen it on the front of a book. What is this book? And this book was done by a man who's a science writer, but also a very skilled cartoonist. And he just told the story of his family's encounter with his mom's cancer. And I remember looking at this and thinking like all of the things that I think really kind of become barriers between patients and families because we don't see what happens at home. We don't see the big picture of what their life is like. I'm able to see them through this book. Are there more out there like this? Well, it turned out in the UK, there was a doctor who had actually, believe it or not, also come across this book. He ran across it in the Tate Library in London. But he was also working on a degree in medical humanities and bioethics, and that's Ian Williams. And he coined this term graphic medicine to refer to these kind of nonfiction comics in book form that are doing the work of telling patients and family stories from their perspective. And he set up this website, graphicmedicine.org, to just kind of catalog some of those books. But he defined this term, graphic medicine, to refer to the interface between the medium of comics and the discourse of health, illness, disability, and caregiving. And just breaking this down, it's basically like comics about how we think about how we deliver care, how we receive care. What is it like to live with a condition, a disability, and caregiving and illness and all of those things. All of those things, as they express themselves in comics, were what he was really interested in. And fast forward 15 years and more, we actually have a website, graphicmedicine.org, that he started, has developed and expanded because this field has exploded. It was really just, having gotten a few people together who thought this is possibility. This should be taken seriously. And thousands of people throughout the world have agreed. And so this has really been an explosive field. So it's really exciting. So I want to just take a step back and just sort of define the term of a comic as I'm thinking about it in this context. This is my definition. Many comic scholars disagree, have very different ways of thinking about it. But I think of a comic as sequential art that conveys a narrative and often incorporates text. So you have image, image, image. The gutter is a space between panels in a comic, and it implies time. And our brains instinctively work. It's really fascinating. There's some fascinating research out there about the ways that our brains instinctively will assemble these images into a story. Even just looking at that 4-panel, we could all come up with a story of what's going on there, right? It's really fascinating. And so what exactly is graphic medicine as it's kind of like out in the world? Well, part of it is we look at these graphic memoirs of experiences of illness, disability, and caregiving that, again, have exploded since the time of mom's cancer. Here's another terrific early example. This is a book called My Degeneration by a young man living with Parkinson's. And what he does in this book is actually makes the visual metaphors that we think about what happens in our bodies, in our illness, in our caregiving, and in our health, literal, right? In comics, you become the master of space and time, and so you can make anything happen. And so he does that in this work that's really useful and helpful. And again, particularly for family members of someone who's going through this, caregivers, etc. Another great example is a book by Ellen Formey about manic depression. And in that book, she does amazing work. But one example is this terrific metaphor she uses to show us what it's like to be cycling between mania and depression. And just imagine the amount of text it would take to describe this, but like how efficient the gestalt of this image is. Just, it's right there, right? You feel it. And there are so many great examples in these books. And there are thousands of these books. Here are 9 books just about the process of getting pregnant, trying to get pregnant, perinatal loss, postpartum depression, infertility, just all these things. There's just 9 titles and there are more out there that I could show you just about reproduction. Here are a number of titles meant for young adult readers that cover topics like disability, anxiety, GI disorders, end of life, the transition of changes in your body in adolescence, bullying, substance abuse in the family, and all these topics are covered in these texts for young adults. There are a huge number of books around cancer, and these are just a few examples. Same with mental health issues. And issues that are outside of the clinic and outside of the hospital are very important to us as well, because anything that impacts your mental and physical health it can be a part of graphic medicine. So these are a few examples about police brutality, bullying, racial injustice, war, migration, and climate change. And so I just want to make it clear the topics that are not necessarily hospital-based or healthcare clinic-based are definitely part of what we do. But this is the core of it for me, why I advocate for graphic medicine. And this is a panel from the Graphic Medicine Manifesto, that those best positioned to represent illness and caregiving are those living with it. And that's the motto of the disability rights movement: nothing about us without us. And that's important to me because I really believe that as a caregiver, we're not the people who are the authorities on their care are the people living with the illness and their families. And that's unfortunately not how medicine has been organized. And I'd love for graphic medicine to be a part of the change, because in these texts, in these books, and we read them in medical schools, nursing schools, support groups, as people read these books, the people living with it become the authority on that care. And that's really powerful. So I mentioned that I'm going to talk a little bit about the ways comics are being used in healthcare today. And I'm going to focus on a few areas: education, reflection, research, and advocacy. And when I say reflection there, I'm also incorporating not just reading these comics, but actually making them as well. So using the power of drawing as a way of knowing and a reflective tool. So I'll start with education. I really believe, after using comics as an educational intervention, and of course, this is not the beginning of it. Public health has been using comics for a long time, particularly during wars and crisis. Comics are great teachers, especially when there's a high density of information. So there's a lot that you need to know. It's really important that you learn the information. So there's a high level of importance to the information, and you're in a high stress situation. Of course, my medical students all say like, well, that's medical school. We should be doing medical school through comics. And I don't disagree necessarily. But also think about being diagnosed with cancer, right? You have to suddenly learn all the pathophysiology of the cancer that you have. You have to learn about your treatment options. It's really important that you understand the basics of all of this, but we all know we don't learn well when we're stressed out. Hence comics, right? They're this intervention that can transcend language barrier, literacy challenge, and bring this visual attraction and appeal to the information that you need to know in a stressful situation. And the other piece that I haven't called out here is the sequential nature, right? One box at a time, one tiny piece of information at a time that builds on itself. And then comics, of course, can also be low cost and low tech, so they can be a really efficient intervention in situations of crisis and maybe lack of funding, whatever. We certainly saw this during the AIDS crisis, and we also saw it again really reemerge during COVID. So here's a terrific example I like to use. This is Alex Thomas. He's a pediatric allergist and immunologist. And he and his partner, Alex, created something called Iggy and the Inhalers. Alex was a kid with asthma who thought it was really unfortunate that the two inhalers were not clearly labeled. This is your rescue inhaler to use in an emergency, and this is your kind of maintenance inhaler that you should use once a day. They're not standard notified, labeled or anything like that. So these characters he created, on the far right there is Coltron the controller, and behind him is Bronco the bronchodilator. And through using these sort of visual metaphors and the powers that these characters have, the kids that they researched this with at asthma camp in Wisconsin came out with a pretty sophisticated understanding of not just their asthma, but also the pathophysiology of their asthma, but also the pharmacology of their medications. And then the characters themselves are used as stickers on those inhalers to help them keep with that plan. And so the success of this has him and his business partner, Alex, moving into a wider range of comics projects that are not necessarily aimed at kids, but adults on very serious topics that we all need to learn in a way that we can manage when under stress and dealing with difficult circumstances. And I could give an entire lecture on educational comics, but I'm going to move along to the next topic here. Oh, but before I do, here are a few texts that have started to come out that actually kind of like in 3 of those books are really focusing on areas. Well, and I know my colleague Whit will be speaking more about graphic public health, but then there's a book at the bottom about using comics and drawing with people who have experienced trauma and in bioethics and kind of doing the work of the fields that we are in using this medium. Each medium has its own, each field has its own way of using the medium that's really powerful. So I mentioned comics as a reflective tool. Andrea Kantrowitz is educational, as a PhD in education, but also a fine artist. And so she created this beautifully drawn book called Drawing Thought. And she says, drawing is a way of constructing ideas and observations as much as a means of expressing them. When we're not ready or able to put our thoughts into words, we can sometimes put them down in arrangements of lines and marks. And this is something that within graphic medicine, we've really come to lean on as an incredible tool in patient family support groups, educational interventions. I could show you 2 examples here. One was that I was invited to New York to work on a project to get people to talk about their end-of-life care wishes long before they need them, which is when we should be talking with our patients and our families. And so I said I would do a workshop getting them to draw about this. So here's a table of adults with crayons drawing what the prompt was, draw a good death. And they very much engaged with this. And some of them had family members there. And one woman joked, I'm just going to give my family this drawing and tell them, get me as close to this as possible. Right? Because then they're basically expressing their values, their wishes, who they want there, who they don't want there. All the things we ask people to fill out forms about can actually be done really powerfully in a drawing. And so this was a really wonderful way I've used comics and drawing as a way to do important healthcare work. Another example is I use this kind of an approach with my medical students. I say to them, draw a clinical encounter. And these are 1st year, 2nd year medical students. You'll notice I don't say that you've been in. I don't say this is real. I don't say this is theoretical. But what's really fascinating is when you do these exercises, what needs to come up, and maybe as Andrea Kantrowitz says, you don't yet have the words for, it tends to come out. And so this is a first-year medical student saying, I'm really struggling with this. And the conversations that we have around these drawings as we get up and put them on the, under a projector and we talk about these drawings, we have really important conversations about the things they're experiencing. So these are just two examples of how drawing can actually be so helpful for us. Here's another wonderful example I like from my colleague, Michael Green at Penn State. He created this project talk with therapists and social workers. And it's basically a little zine, a little booklet that people are given, family members are given before they're about to have a meeting, days before they're going to have a meeting with the care team about their loved one who's in the ICU. And presumably, Michael's a bioethicist, presumably they're facing some difficult decisions. And, we do these conversations all the time, but we never really think about like giving the opportunity to prepare themselves. And I just love this project, having been in these kinds of situations. Again, it's very basic kind of hand-drawn zine, and it gives them the opportunity to explain how they understand the situation, what the doctors think, and what they think the prognosis is, and the opportunity to say like, I don't know, no one's ever explained this to me. Here's another one that really prioritizes their concerns, right? What are you most worried about? I want you to kind of write this down or draw or respond to this prompt so that we can have that information and you're not just going to feel overwhelmed by what we're talking at you in this meeting. There's another opportunity for them to actually give their feedback about the care that they're getting. And then finally, as an ethicist, he's getting them to sort of that, and these are just a few pulled out pages of excerpts. This is a whole cute little, like maybe 10 to 15 page booklet that focus on their values, and let's think about the values we're going to use as we have this conversation and talk about care. So that's another wonderful part. But again, I could spend a whole lecture on just how we use drawing and reflection, but I'm going to keep moving along. So let's focus on research. I want to talk about three ways we are using graphic medicine in research. First is as the intervention. Second is for data collection. And then third is for data dissemination. And I'm sure there's more out there, but this is kind of how I'm thinking about it right now, about 10 years into doing this aspect of it. So here's an example of as the intervention. So this is a pediatric clinic at the University of Chicago. And the care team was feeling like patients were reporting that they felt that the computer was really impinging on the care that they and their family were getting, that the doctor spent more time having to look at the computer than at them. So we created this very simple ABC approach to kind of let them know what their rights are, that they have the right to ask to see the screen so that we can look at it together. And then B, you can become involved. You can look at the screen and say, yeah, no, I'm not taking that medicine anymore. And the doctor can say, okay, great, we're going to take that off. And then finally, they can actually ask the doctor to step away from the computer. That, this is like, so they're given this handout on cardstock in the waiting room, so they have an opportunity to consider it. And then the team that did this research, I did that comic, and then the team did research, and they had some really good outcomes from it. It showed that a few months out, many of the patients and families actually remembered, almost 100% remembered the comic, but about half of them talked about, they could actually name one of those interventions. And if you think a few weeks out, or a few months out, that's pretty good. And then they actually reported that they had started doing some of those things in subsequent visits. So that was really exciting. So that's the comic as the intervention. Moving along about using a comic for data collection. Well, you'll recall so this, and there's two ways I'm thinking of it here. One is a study where you'll recall the book I mentioned, My Degeneration. My colleague, again, Michael Green at Penn State, he actually had neurologists who care for patients and families with Parkinson's and their staff, the nurses and the office staff, read this book by a guy with Parkinson's, Peter Dunlap-Scholl, and look at the ways in which he actually wonderfully depicts caregivers, because we show up as characters in these books, and the metaphors they're using. And he then did a study to kind of say, got them together, did a focus group and said, like, what did you learn? And when they published this, they said, after reading this book, the confidence in understanding their experience of their patients increased significantly, right? And I always tell my medical school students, when you read a book by a patient with Parkinson's, you're not going to know what it's like to have Parkinson's, but I would hope you're going to ask more informed questions, right? And again, elevating the voice of patients and families. So that's another great way of using it for data collection. And then another thing we can do as data collection, of course, is if we have our our support groups, our family members, the women in our studies, if we have them make drawings or comics about their experiences, we have a workshop, for example, and we all make a comic. Or, how I do with my students, I've been doing this for about 15 years now. I have a lot of these kind of comics of drawing and intervention. We can pull data from this, right? What are the themes that come up? The one on the left there you see is the ways in which, those are two hands coming together at the encounter, but we see the ways in which things external to the encounter are impinging on that encounter. Or the way that these are two very similar ones where the student feels that they are so kind of dwarfed in the presence of the patients that, they want to do a good job for, but they're just little, so we could get data from this, right? We can say, oh, everybody kind of drew that they're feeling really isolated. So that helps us sort of focus our research. And there's a guide to kind of thinking about this stuff. Chapter 5 in a book called Research Methods in the Health Humanities. My colleague Muna Al-Jawad and I actually kind of codified some of this and how to look at drawings like this and think about how to pull data from them. So there's some tips in this text if that's of interest. And moving right along, I'm getting close to my time here. The last piece here is data dissemination as translation, right? So we've all heard of looking at a research study and creating a visual abstract. I like to think that, charts and graphs are static, and those are great to include in our studies. But the thing about comics is they're actually active, right? We've got one panel and then, and they can actually be pretty effective. Here's a wonderful example of a comic that actually disseminates data and is very true to the study. So I've talked about the areas where comics are being used in healthcare. And for this last area here, advocacy, I would just be showing you the work of our next speaker. And so in addition to talking about comics and advocacy and much, much more, I'd like to hand it over to my colleague, Whit Taylor.
MK, thank you so much. That was fabulous. And I just wanted to hop in and thank you before Whit takes over.
Hi, everyone. MK, that was wonderful. Thank you. And thanks to ORWH for having me. Let me share my screen and we will get started. Let's see. Okay, so today I'm going to be talking about comics for health communication. I'm just going to give you a quick overview of my experiences in comics and public health, and then I will be talking about the different ways that comics can be used in communicating about health promotion, health education, things like that. All right, so about me. My love of comics and science started as a child. As a child who had trouble, staying on task with reading and things like that, I was introduced to comics as a way of perhaps helping me focus more, and it definitely worked. As a teen and young person, I started to read and make comics to connect, cope, and learn. So, as a child, I read superhero comics, things like Archie. As I became older, I discovered there was a whole nother world of comics, that there were personal narratives, there were nonfiction comics, that there was, everything that you could imagine. And so for me, reflecting on my own experiences, trying to understand things like my own identity, trying to just understand a lot of things about myself and the world, comics were a great way to help figure those things out. And I also used them as a teaching tool. So when I was in undergrad and I was in grad school, I'd often make comic study guides when I was studying for an exam, because it was one way that really helped me synthesize and remember information. I also started to build this health career alongside my comics career. They eventually did merge, but I started on the small press comic scene about 15 years ago, just self-publishing and tabling, and then eventually starting to work with publishers and become an editor. So I would say that one thing also that really stuck out to me too in my professional years was working as a high school teacher, and having to talk to students, especially in underserved areas, where I would have students come to me with issues like, I'm pregnant and I don't know what to do. I don't know where to go. I actually worked at a pregnancy school for teens as well, and encountered a lot of gaps in comprehensive health education. After grad school, I went to work at various different colleges doing health education, where we even used comics as teaching tools. and then transitioned more into full-time comics, both making my own work, both web and print, and then working as an editor, most recently and most intensively for the Nib, which formerly the Nib, which closed this past year, which was a site for political comics, comics journalism, and nonfiction comics. So I have also worked as a health educator clinically as well, especially around women's health, sexual health. And I am a mom. So to me, comics, public health, and parenting are all community oriented at their best. And that's kind of my philosophy. All right. So the value of storytelling. People love stories, good stories and bad stories. So there's a lot of different ways that we tell and receive stories, books, memes, podcasts, periodicals, blogs, video, word of mouth. And social media is a really big one. I think we've seen the power, especially in recent years, of social media and storytelling. We see the capacity for stories fostering empathy, connection, um, stories being educational, teaching tools, and also stories just being fun. Um, and then on the flip side, there can be appeal to emotional reasoning in a negative sort of way through storytelling. And stories can also promote misinformation and harm. So when we see popularity of things like, Instagram, Facebook, TikTok, Twitter, things like that, we both see people connecting in wonderful ways over social media sites. We also see the proliferation of negative things such as misinformation. One thing we're currently dealing with, for instance, is the anti-vax sentiment in this country, which is becoming particularly challenging, and places like social media are, a perfect place to perpetuate that misinformation. I'm going to share a little comic with you. This is a comic that it's very simple. It was, I think, posted on Linda Barry's website, but it really sticks out to me because I feel like this really encapsulates the power of comics. So the top panel, the mother says, "I'm not sure how to look at art. What's supposed to happen?" Next one, "Something big, a revelation. Suddenly you just understand. Not sure how to make it happen. How about lift me up so I can see better?" Um, Linda Barry is a cartoonist. She's a professor at the University of Wisconsin-Madison, MacArthur Fellow, wonderful educator who is who I can't recommend highly enough. Her book syllabus, what it is, and teaching comics or making comics, those are all wonderful texts if you're really looking to, even just for yourself, get into the spirit of cartooning. All right. And so MK had a really great definition of comics. I'm just kind of going to piggyback on that. Um, Comics are sequential storytelling usually. So when we think of things like one panel comics, that is also a form of storytelling, not necessarily sequential in the way we usually describe it. Comics are most importantly a medium and not a genre. That often gets confused. So genres are things like, science fiction, romance, stuff like that. Comics are a medium, just like, painting or film. A way of communicating. They're visual. They are reproducible and shareable, which I think is particularly important. Whether that's somebody texting their friend or sharing with their friend a comic on Instagram, or zines, which are wonderful because they can be cheap to reproduce. All you need is like a copy machine and some paper. Um, and They are a tool of abstraction. They're a tool for thinking, communicating, processing, synthesizing, and understanding the world. And they are everywhere. So, like MK brought up, the flight pamphlet that you get when you're seated in an airplane. That's something that is part of our culture. During the early parts of the pandemic, we saw a lot of images about sequentially showing how to do correct hand washing. That is what I would consider to be a comic. These are things that we're just used to in our everyday life. And I'm going to define a few more things. So these are just two definitions that I happen to like. Public health is the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. Sir Donald Atchison. And then from WHO, health education is any combination of learning experiences designed to help individuals and communities improve their health by increasing their knowledge or influencing their attitudes. All right, so comics for health education. Comics can translate complex, technical, and often dry concepts simply and visually. They can teach individuals and populations in a way that's engaging and empowering. And then they can tie the past to the present and the future. And I'm going to go into each of these in a little more detail. So, comics can teach individuals and populations in a way that is engaging and empowering. Um, I think that comics can be thoughtfully crafted for various audiences. So that's something that I think about whenever I'm creating a comic. Is this for a general audience, or is this for a certain age group, from people living, or from a certain culture, living in a specific location, things like that. And some wonderful examples are the work of Malaka Gharib, who is a journalist for NPR. This is a comic she did in 2020 at the beginning of the pandemic called Exploring the New Coronavirus, a comic just for kids. It was specifically tailored to younger audiences and made available in a PDF format that could be folded into a zine. And this got a lot of a lot of downloads. It was very popular. And I also think it's just because of how clearly and simply and invitingly how it was illustrated. Another example is this line from Limerence Press / Oni Press, which is based, I believe, in the Pacific Northwest. They've been doing this quick and easy guide series. So these are some examples of queer and trans identities, a quick and easy guide to sex and disability, a quick and easy guide to consent, and Wait What, which is another part of their series about sex ed for teens. And one of the creators, her name is Isabella Rotman. I've been using her comics to teach sex ed since I was working in colleges, and they were very, very well received. Friota Wilberg's Draw Stronger from the publisher Uncivilized Books is another example, specifically geared towards visual artists and cartoonists, but really it could be for anybody who sits in an office in a desk job. It's perfect. So comics like these can build self-efficacy and foster skill development through modeling. So a lot of these show how to do things, how to stretch, what type of regimen you should take to make sure that you keep your body healthy and limber. And they show pictures, how to put on a condom. Another thing is how to have a difficult conversation with someone. These things model things. And we know that when people feel that they have the ability to do something, when they feel that they have that self-efficacy and it's modeled for them, they're more likely to change those behaviors or to change their attitudes about something. And comics are a great way to facilitate that. Another example is for teaching individuals, populations that in a way that's engaging and empowering. It can destigmatize sensitive topics. I think comics has always had a wonderful way of engaging in things that might be difficult to talk about. So mental health is a big one. This is a book called Let's Talk About It. It's actually a comic pamphlet from creator Cara Bean. It's a guide to mental health. And it's part of the graphic series from the Center for Cartoon Studies, which is based in White River Junction, Vermont. It's a school for cartoonists. They have an applied cartooning program there, which is really how do you use comics for the greater good? How do you use it in an educational, instructional way? So this book was created for teens, and this creator Cara Bean is now actually putting out a book in April that is a guide to mental health for children. Another example of this is from artist Kate LaCour, and this is on harm reduction and safe injection. And this was made for a nonprofit in New York City that is a harm reduction service. And there's many such things. There's many such comics out there that really do broach these very important but sometimes sensitive topics. Like MK mentioned, comics can be a tool for advocacy. This is an example. This book is called Comics for Choice. I am one of the co-editors on it, and it was originally published in 2017 and got its second second printing this past year with some updated information as laws have changed. This was something that we did in partnership with the National Network of Abortion Funds, and We Testify. What we ended up doing was actually connecting with people who had had personal experiences with abortion, connecting them with artists and illustrators, and having them work with that creator to tell their story. We raised money through this for National Network of Abortion Funds, and we also went over, historical and legal aspects of abortion, just to kind of give a round picture and context to everything. Okay, they can translate complex, technical, and often dry concepts simply and visually. As we know, public health, medicine, health education are not always known for being the most dynamic in terms of, when we think about how they connect with people. I didn't say that quite eloquently, but my point is that comics have a way of kind of bringing out the, I will just rephrase this. So, um, comics are wonderful in that you can use devices such as visual metaphor, which is what MK mentioned as well, to explain theoretical concepts. So, for instance, right below is a picture from Mona Chalabi, who is a data journalist, a reporter, who's won the Pulitzer Prize for some of her visualizations on COVID-19. This is an example of one causes of food poisoning, and it's kind of silly, but like I think it does get the point across. It helps people understand um, things that might be hard to really grasp, that might seem kind of distant or removed. So this really shows it in kind of a fun way, and it kind of helps helps people have a greater understanding. It's great for risk communication. Another example right down here is to the right is part of a comic that I made on maternal mental health and race, which came out in 2020 through the nib. So here, the visual metaphor here is using a child's stacking toy to talk about the sustained research-informed multi-level approach to decreasing poor maternal health outcomes among Black women in the United States. All right, continuing with that, I have an example down here. Vaccines Work, Here Are the Facts by Maki Naro on the left. This was also published by the nib. It came out in 2014, still very relevant today. And it's talking about herd immunity in this case, which is something that's very, technical, maybe a little bit removed from the average reader. And so to illustrate it and kind of bring it to life is something that is really helpful for people who might not have a background, for instance, in physiology, immunology, things like that. Also, Health and Wealth is another example, another CCS graphic guide. This was created by James Sturm, one of the founders of the Center for Cartoon Studies. He was a Harvard Radcliffe Fellow back in 2020, 2021. And he worked with a group of healthcare professionals, illustrator Kaz Lee, to create this graphic guide to the US healthcare system. Again, the US healthcare system can seem overwhelming to the average person. It's very complicated. So first of all, to illustrate it graphically using Richard Scarry-esque characters, which is something that people are very familiar with, kind of, makes it more approachable to people of all ages. And it can tie the past to the present and future. Comics can provide a historical context and help us re-examine the past. So one example here is No Ordinary Flu, which I feel is very influential to me. I first attended the Comics and Comics and Medicine conference back in 2014 when I was just trying to figure out, I was fresh out of grad school. I'd always wanted to do something with comics and public health. And going to this conference was very eye-opening because I met so many people from so many different disciplines who are really hoping to use comics as a teaching tool. And Meredith Lee Balmer, who MK mentioned, made No Ordinary Flu. She is a communication specialist for a Seattle Kings County Public Health Department and also a professor. And this was on the 1918 flu pandemic and just provided a lot of context also for people to keep in mind of what, future pandemics might be like. Right below that is a panel from a comic that I wrote that was drawn by cartoonist Chris Kindred on the Tuskegee syphilis study, and exploring, the history of that, as well as looking at the state of healthcare today and mistrust in healthcare among Black Americans. And this is actually a springboard for me because I'm currently working on a book with illustrator Joyce Rice for Macmillan for a Second, which is going to be a history of public health in the United States, where it expands on a lot of these issues, just so that, we can have more context for the world that we're currently living in. And comics also help us evaluate and challenge current societal structures that perpetuate health disparities, for instance. So, this previous one was an example. Another example I provided here is from the Nib, from Larry Harris, who's a deputy editor at the Nib, on the history of IVF. That's another one, providing historical context, and then going into, she went into her personal struggles with fertility, going into IVF and the industry around it. So these really can teach, anybody really about the world we're living in and how we've gotten to where we are. And I should mention too that Larry Harris and Shay Merck, who were two former editors at the Nib, will be putting out a book on nonfiction comics and comics journalism from Abrams in 2025, which might be of interest to folks. And then a few more examples. So they pave way for improved public health practice. These are some examples of comics and graphic novels kind of discussing contemporary issues in public health. So Seek You from Kristen Radka, who was art director at The Believer, which was a magazine. She did a graphic novel on loneliness, which is a public health issue, a public health epidemic, some might say. Dan Knott is another cartoonist who just got a nomination for National Book Award for his book Hidden Systems, which looks at the infrastructure of everyday life. That, I would say, is also connected directly to public health. And just going back to graphic public health from Meredith Lee Balmer, this includes a lot of the work that she's done in her role as a communications officer, working with different people at the clinic and different artists to talk about the state of public health and how comics can be used for everything from risk communication to health promotion, etc. So this is just like a brief overview. But my point is to say that I think that the group of people reading comics is only growing. We look at book sales nowadays, for instance, and we see that middle grade and YA comics are one of the fastest growing markets in books right now. It's actually pretty wild. Those readers will eventually become adults. And if we can teach comics literacy at a young age, we can also teach health literacy, and we can combine those two. So I see comics as being a very bright and promising means through which to really teach people about health literacy and to promote healthy behaviors. So I will end there for now, and we can, I guess, go to questions. Thank you.
Thank you, Whit, so much. This was really fabulous. And thanks again, MK, as well. And also thanks to the many attendees who have been blowing up the Q&A. So we will hop right into these, and I encourage folks to also continue that conversation online in the Q&A. And so we did get a question that either one of you could answer. How do you get buy-in within an academic environment? Someone else asked about at NIH to try to implement graphic medicine in research, interventions, or translation, given that some academics or the other questioner was asking about NIH staff can be more or less receptive. either one of you.
I can start. What I've found, because I've had an interesting experience, I found that medicine has been very willing to kind of take this up, but I've had a little more resistance in nursing. I think it's because it's, there's a lot of reasons I won't go into. But what I found is if I can get to a university and they let me speak with the faculty of the nursing school, all you have to do is show them the work, right? Like the kind of things we should just show them the comics, have them read them together. Just really just once they get their eyes on these, what's out there, they are convinced and it starts to get some uptake. So that to me, if you want to kind of just get it in front of them, whether in a presentation, have it in your slides, read through the comics, just show how it's doing the work that are their goals.
I can really only speak to like a younger population. So middle school, high school students, college students, just even anecdotally, those were some of our most well-received and most well-read materials were comics, honestly. There's something too that can be shared, that can be passed to a friend. And I think if we look at how we're using media nowadays, especially with younger generations, where are people getting their information, whether it's correct or not, a lot of it is coming through, the internet, through memes, through infographics, things like that. That's what we're seeing a lot of. So I think that as comics become more normalized again, and as we're able to see that they're not just something for children, but they're something for anybody, they're just they're a medium, that hopefully people will be able to expand the way that they think about them.
Thank you. And I'll do another twofer, and then maybe Mia, you can handle one. So we had a few questions about how to make the connections, right? So how can I find a cartoonist? How do I connect my comics to healthcare providers? And so we would love to hear your thoughts on.
Sure, I can start if you want. There's plenty of great resources out there. I know I'm sure MK will talk more about what they're doing with graphic medicine. But there's plenty of databases, for instance, out now. There's a Cartoonists of Color database. There's a Queer Creators database. There's various and women's cartoonist and illustrator databases out there where they will provide information on the artist, links to profile, things like that, website. There's plenty of folks looking for work, which is exciting, and I do recommend working with somebody who is seasoned and has experience in visual communication. I think that's super helpful. What else would I add? And I think there is also more receptiveness in general that I've seen in recent years. I'm seeing a lot more places like, the Washington Post, the New York Times, major news organizations that are really starting to use comics in print and on web. So I think it's a great time for it.
Yeah, if I could hop in, another great way for researchers to find a cartoonist to work with is go to your local independent comics expo. So like in Bethesda, there's SPX. There's Boston has Mice, Chicago has Cake, something called Cake, the Chicago area, whatever, every kind of larger area has, and even some smaller areas and university campuses has basically comics expos. And a lot of times what you'll find is people who are maybe with PhDs in different fields who are then integrating comics into that field. And also what's great about it is you can walk a room and see like hundreds of cartoonists. New York has an expo as well. I'm thinking you just walk through and you can see the visual style. You can chat them up about their experience, their availability. So those usually annual events are, and of course we have an annual graphic medicine conference where people can meet cartoonists. And also we're hoping to put together a database as a resource. We're really working on resource development on our website. And one of the resources we want to develop is that kind of database to pair artists with researchers. But you can email us through the website too, because we often kind of know people who have projects and have the skills and all that. And then there was one other thing. Oh, someone had asked about like, how do I get and I got the idea that the person who asked the question had made comics about their experience. How do I get my provider to kind of maybe connect with that? I would highly recommend take your comics in to your appointments. I've done it. I've given my my doctor, my book, a copy of my book on menopause, and they're usually really excited to learn that you're processing the experiences and can help even maybe sometimes use those as resources for other people. So if you're comfortable with that, I would highly recommend just bringing it into your provider.
And just to add one more thing to that, yeah, I just want to second what MK was saying about shows. That those have been one of the best experiences personally for me, and just in terms of meeting diversity of creators. Um, SPX, the Small Press Expo in Bethesda, Maryland, also has a great program with the Library of Congress where they're cataloging a lot of these works. So there really is an effort, and I think um, a value that the larger community is starting to have about preserving these works. Also zine fests, which tend to be smaller, a lot of regional zine fests. Zines have a long history of with activism, and that's a place where you can also often find a lot of local low cost produced products.
Thanks. And Mia, I think we have time for one more, if you have one more for us.
Oh, sure, that'd be great. And so I'll say the WIT, I loved it that you talked about intentionally about health disparities populations. And as you know, both in terms of research, but sometimes just around health topics in general, there are definitely underserved communities or communities that are not well represented in research. So I wanted to encourage you both to kind of give us some thoughts about graphic medicine as a tool for health education and for underserved populations, and also as a part of the process to sort of amplify community-based processes or community-engaged research.
Thank you. MK, would you like to speak first, or want me to jump in? So one thing, just thinking about one of the strengths of comics, again, is low cost, easy to reproduce, easy to distribute. So I have heard of things like that being brought to where people are. That's often one of the best ways to actually educate and give people resources, is to go to where they are. So for instance, in certain communities where like a hair salon might be the place where people gather and get information, there have been studies and pilots where people, for instance, will bring small comics about a relevant health issue to a place like that. Last night I was reading an article about suicide deaths by gun in Wyoming, and how Wyoming has the highest rate of suicides by guns, and how gun shops, because the laws are likely to change for political reasons, gun shops are becoming a place where people are going to actually develop connections with people around mental health and have those conversations. So I was like, that would be a great place to have zines, for instance, about mental health. There are comics about mental health. So I do think that there is a great there's great capacity to do more community-based research and dissemination.
And I am so sad to cut this conversation off. This has really been a phenomenal session. Thank you both for sharing your time and your expertise. I would like to call everyone's attention in the chat. We shared the link for registration for our next session, which will be in March, and will focus on endometriosis. And our two speakers today have really generously agreed to answer any questions that they were not able to get to today. And I've put their emails in the chat. So thank you both for that. On behalf of the Office of Research on Women's Health, it is my real honor to again thank you both for your time today. I'd like to thank also our IT support, Mike, and our captioner, Cynthia, as well as the communications team for their promotions of this event, and the whole team ORWH working on the back end, and invite all of you to stay in touch with us, nih.gov/women. We have lots of stuff happening, and hope to see you all in the future. So thank you so much, and today's session is adjourned.